50 days before UPSC CMS, most aspirants are making the same mistake. They are treating all topics equally. So instead of just solving the PYQs, every UPSC CMS question from the last decade was broken into exact topic. Look at this, the pain acute appendicitis. And we have done the analysis of every questions. We have chosen the GI surgery topic and we have did analysis of all the questions, topic by topic and question by questions. Like look at this clinical question asked from the acute appendicitis, like pain, abdomen, migrating to right iliac fossa with vomiting. So if you'll read your clinical part of this acute appendicitis from your notes, then you can able to solve these questions. And like other question, you can look at this small bowel obstruction. They have asked regarding the mechanical versus paralytic ileus differentiation. So if you'll read the notes regarding this paralytic ileus and mechanical part concept differentiation, then it will be easy to solve these type of questions. Other questions they have asked like perforated duodenal ulcer, like PUD perforation, what will be the management? They have that is the Graham patch repair. So they have mainly focused on the operative part of that perforated duodenal ulcer. So these are the things where the UPSC CMS are mainly focusing. So after analyzing these thousands of data points, something interesting appear. Like you can look at this topic tiring. We have did like the most important, the tier 1, it should be master. Like some topics kept showing again and again, and others barely appeared. The pattern was impossible to ignore. Like they have asked questions like from the mesenteric ischemia many times, like from the question from the lower GI bleed, obscure GI bleed, intestinal obstruction, bariatric surgeries, shock, damage control, resuscitation, head injury part. So you can look at these topics, how we analyzed, and you also have to analyze like this. Then only it will be very easy for you to crack the UPSC CMS. So these are the topics from the tier 1 which you have to master. If you come to the tier 2, these are the important topics, but you should not have to read in depth. Like you just have to read the basic part of like upper GI bleed causes and how you're going to manage, like pancreatic carcinoma, chronic pancreatitis, surgical indications, what will be the primary hyperparathyroidism. So these are the topics which you have to master, just the basic part of that these topics. Now we'll move to the tier 3. These are the topics are very low frequency asked, like the curvature sign, gas gangrene, soft tissue sarcoma, where you just have to look at these topics and revise the very basic part of this. They are not going deep into these topics. So you can look at this, how we have analyzed all these topics in 3 parts, tier 1, tier 2, tier 3, where tier 1 topics you must go into depth and read all those topics. They can ask any question from this tier 1 topics, and tier 2 just you have to read the basic parts, and tier 3 you have to look at these basic things to crack the UPSC CMS exam. We mapped every topic based on frequency and exam relevance. Not all topics deserve the same amount of your time. Only after identifying those patterns, like thyroid nodule evolution, you can look at this from 2014 to 2025. They have asked how many times this question, like papillary thyroid carcinoma, follicular thyroid carcinoma from the endocrine surgery part, like medullary thyroid carcinoma, anaplastic poorly differentiated carcinoma. They have asked only 2 times till now. So we have done this topic frequency matrix for each subject, each topic, and so we have prepared all these things for you so that it will be easy for you to solve and crack the UPSC CMS exam. So only after identifying these patterns, we build our subject-wise tests, and PYQ mini tests that show exactly how many times a topic has appeared in previous UPSC CMS exam. So because with only 50 days left, your biggest advantage isn't studying more. It's knowing that what deserves your attention first. Like average aspirants revise topics again and again, and top performers revise patterns. Which one will you be? Hope this is going to help you, and it will make you understand how to analyze the topics and how to move ahead for the preparation of the UPSC CMS exam. So if you want to give all the tests, so you can use my coupon code. It will help you in giving those tests easily. Thank you.